Why don't we start out by having you give us a little introduction on yourself?
Okay. So my name is Audra. I am a pelvic floor occupational therapist. I am the owner of Autonomy Pelvic Health, which is my pelvic health and wellness clinic. It's located in Leominster, Massachusetts. I offer both in-person and virtual sessions for people. My primary focus is working with the adult population. I see people of all genders. Um, but one of my favorite things to treat with people is helping to eliminate things like urinary leakage, prolapse, diastasis recti. And I'm also becoming very much interested in managing chronic conditions because I see how important that is. And with my
Hmm.
background as an OT and other various settings, it's very important that we are able to help people with overcoming symptoms, but also with trying to help modify and help people manage symptoms, because we might not be able to necessarily resolve things for people, especially if they have a chronic condition.
Yeah, I love that. That's all super important. And I feel like, yeah, just even you touching on the fact that like definitely can't completely take away some of the things. Like for me with like endometriosis, I've done pelvic floor physical therapy and um I feel like my mindset was like, how can I like make all of this go away? And I feel like maybe that's why I felt like it didn't work that well for me. But in reality, I should have been like, oh, like how can I take my symptoms from like a 10 to maybe like a 5? And that would have been more manageable. Um, so yeah, but I think that also maybe had to do something with like I was like 20. So I was like, I don't want to deal with this forever. But now I'm a little bit older and I understand more what like living with a chronic condition means. So um but yeah, I also wanted to ask, so like what exactly is a pelvic floor OT? What does that mean?
So pelvic floor OT works just like a pelvic floor physical therapist. And I think a lot of people ask like, oh, like what's the difference between the two? And I think it's hard to differentiate between the two because it really is
Hmm.
dependent on the clinician themselves. Like some people are listening to this, if they are pelvic floor therapists, they might be like, well, what do you mean by that? Like both OT and PT are definitely separate disciplines, but we don't learn about pelvic floor therapy when we go to school. This is usually something you have to take after you finish your graduate degree or your
Hmm.
doctorate degree, and like whichever, if you're PT, right? So we're all kind of in the same boat where we have to learn the anatomy and learn the functions and the treatments and things like that.
Hmm.
So with that being said, I always tell people, Italy OTs have a lot more of like a holistic approach where we take a whole body, both looking at physical, mental, emotional well-being, things like that. Whereas physical therapists take more of like this kind of biomechanical approach. But
Hmm.
I've seen physical therapists who are a mix of both. They are holistic, and then I've seen OTs who are a mix of both, right? So
Yeah.
it's kind of hard to like differentiate. But traditionally, like OTs, right? We help people with being able to do the activities they need to do day to day, right? So like their self-care tasks, which are things like, can somebody get themselves dressed and bathe themselves
Hmm.
and be able to safely function in their home or go back to work and things like that, right? So when we're looking at the pelvic floor component, right, what can we do to help people with their toileting, right? So we look at
Hmm.
bladder function, bowel function. OTs traditionally work with people on returning back to sexual activities, right? So helping people with their sexual health as well, right?
Yeah.
So a lot that we can do, right? We work with people all across the age group. Even though I don't see pediatrics, there are pelvic floor OTs who specialize in pediatrics. You can work with the geriatric population, and you can treat all different type of diet. It's kind of one of those like,
Okay, but that was a really good explanation on kind of like what it seems like in some of those practices too, like even when you're seeing maybe like a naturopathic doctor versus a DO or an MD, like they all have similar schooling when you like go down to like the nuts and bolts of it. Like they're learning the same things, but there's a little bit like naturopaths will learn some like I mean Chinese medicine, really. Like they'll learn a little bit about like herbs and all of that stuff. And then MDs do not get that type of schooling. So, but in the same breath, like I have had an MD who has like referred me to seeds before, which was
Mhm.
surprising to me. So like it really does depend on the clinician, and you can like search depending on like what you want in somebody, you can also like search that out, which is kind of cool in reality.
Yeah.
If you're dealing with migraines, nausea, dizziness, or even those unexpected MCAS flare ups like eye swelling, Hugs cold caps are here to help. These caps are designed to promote targeted cold therapy to your head, offering relief when you need it most. What's really great about Hugs is just how easy they are to use. You just pop it in the freezer, and then when a migraine or nausea hits, you have a ready to go solution that fits comfortably around your head, wrapping you in a soothing cold relief. For those with chronic conditions or other sensitivities, having a reliable, natural way to manage symptoms can make a really big difference. And these are just that. They're simple, effective relief without the need of medication. If you want to give Hugs a try, you can visit wearehugs.com. That's wearehuggs.com and use code chronicpod for a special discount on your order.
Yeah, you brought up a really great point. Is that as we have physician assistants, we have those people, right? And it's like, their schooling is like very similar, and they're all going to learn different things and have different roles, help prepare you to treat you. And
Yeah.
then they may go into some kind of subspecialty or whatever, and then based off of their education, but also what are their interests and things that they
Mm-hmm.
like can be helpful. So, for example, if you're someone that like wants a pelvic floor therapist that specializes in specific like postpartum related care, or someone to help you overcome like birth trauma, right? You can seek out a pelvic floor therapist, whether it's a PT or OT that does it, right? Or if you're someone who's like, I want someone who can address like my child's like constipation, but they also have some like tongue tie issues, right? So you might go to a pelvic floor OT who can address the pelvic floor, but also address like the kind of myofunctional oral function to address the
Yeah.
tongue tie. So, and that's why I think it's important if someone is experiencing like pelvic floor issues that, when they're looking for places, they find someone who they feel is the right fit, right? Which is, it's okay to ask the questions of like, what's your background like? Like, what are your interests? What's
Mm-hmm.
your treatment style approach? Because you want to find someone that you feel aligns with you. I mean, also some pelvic floor therapists, we want to make things accessible, right? You might not be able to find someone who fits what you're looking for perfectly, but
Mm-hmm.
all pelvic floor therapists I've ever met are very passionate about learning, and it's a lifelong learning journey, right? There's so much to it. Like, I'm learning something new every day. So, you ever
Yeah.
stumble somebody that maybe even if they're not like specializing what you're looking for, but their personality is something that aligns with you, take a shot with them, because I bet you they'll say, you know what, I may not know the answers now, but I'm going to help you find them, and we're going to
Mm-hmm.
figure it out together.
Yeah, I think that's so important too when you're especially when you're like dealing with chronic health, you are totally allowed to look around and find somebody that will actually like mesh with you because you are like seeing these people pretty frequently. One, two,
Mm-hmm.
especially with pelvic floor, OT, PT, whatever it is, like that is a pretty vulnerable setting. So you want to make sure that you find somebody that you're actually like connecting with, that you feel comfortable saying that it, you want to make sure you find somebody that you feel comfortable saying you're uncomfortable because
Yeah.
if you can't do that, then you're not going to get anywhere anyways. And I think that I struggled with that and it had not, it actually had nothing to do with the PT, but it was more so I think I just like didn't ask enough questions about like what was going on. And there were like some things that were like painful for me or uncomfortable, and I just didn't say anything because I was like, well, I don't know like what is supposed to like it's definitely not supposed to feel good. So I'm like, I don't know what I'm supposed to say. I don't know. I think that also like you're definitely allowed to ask questions before you start anything like that and ask like what exactly are you going to do? Like what's it supposed to feel like? Is it supposed to hurt? Is it supposed to be uncomfortable or like what can I say if it is? And yeah, I feel like there's just a lot that goes into it and you're totally allowed to ask questions for like everything.
Yeah, and then even a clinician that will be proactive and will be aware of, this person might not be telling me everything that I need to know to help them. So always
Yeah.
keeping in the back of our head that, like, for example, I have clients like, and I ask on my intake paperwork, I'll ask them like, mental health history, trauma history. And I know like a lot of people are pretty honest and will open up,
Hmm.
but there's people out there where they maybe weren't super comfortable sharing the information. I always say to them, you never have to tell me anything you're not comfortable with. Or I
Yeah.
have people that didn't realize that what happened to them was something traumatic. And then as we talk
Hmm.
about it, we can start to see how the body was kind of holding on to that trauma and kind of manifesting in different symptoms. You know, I've had, for example, the amount of my clients who've gotten things like an IUD put in or taken out, they were like, that was an uncomfortable experience. And then as we
Yeah.
talk about it, they're like, I guess that really did seem very traumatic to me. And everybody's version of trauma is different, you know? And
Right.
some people, again, they just may not know like to say that because they're like, oh, I don't know what's important, what's not, which is why
Hmm.
continuing to see a therapist you're comfortable with and one that can ask questions or, you know, as I always say, hey, don't be afraid to say, this might sound silly or I don't know if it's going to connect, but I experienced this or I have a history of this. Does this play a role? Because likely it does in some way. You know, you'd be
Yeah.
surprised how many people would be like, oh, by the way, and then they mention this little snippet, and I'm like, oh, okay, that's actually really important, and I
Hmm.
appreciate you sharing that, you know. And just like you had mentioned too, especially when we're treating chronic conditions, like let's take endometriosis, and for example, right,
Hmm.
helping people with that mindset of like, yeah, we may not necessarily 100% resolve all symptoms, but at the same time, as we're doing treatments, you shouldn't be suffering either, right?
Right.
So, like when I've worked with endo clients, I say to them, the goal is to resolve, of course, as many symptoms as we can, but also what can we do to manage stuff? And some people, again, depends on what they're looking to get out of pelvic floor therapy. Are they coming to me because they just had the excision surgery? Are they preparing for it? Do they not want the surgery and want to work on
Hmm.
managing symptoms in other ways? So it also kind of depends on what are the goals of the client too.
Yeah. Yeah. I know for me when I did um pelvic floor physical therapy, it was I think like 6 months after I had surgery, but it was the ablation surgery. And that was when I got like diagnosed with endo. And I think that like mindset has so much. And honestly, I hate that I'm saying that because 20-year-old Lexy, 21-year-old Lexy, when my doctors would say your mindset plays a lot into things, I'd be like, shut up. Like, you are annoying me. Like, that is not fair. I'm like, my mindset is not telling my body that it hurts. And I'm not saying that, but I am saying, like, if you are not accepting to treatments, your body's not going to be accepting to it either. Like, if I'm telling myself that this isn't going to work, like, it won't work. So,
Yep.
um, and I do think that that had quite a bit to do with it. I just was like frustrated because there was a lot of misinformation in my diagnosis with endo, and
Mm-hmm.
my doctor was I 6 months after my surgery, I my pain didn't really go away at all, and she was like, "You shouldn't be in pain for like 2 more years minimum." And I was so confused by that because I'm like, I my pain has never went away. Like maybe like first of all, recovering from the surgery was awful. And then finally when I recovered from that, I didn't really feel like it maybe went from a 9 to a 6, but I'm still in like 6 level pain, which was still a lot. So then she was like, "Okay, we'll try pelvic floor physical therapy." So tried that. And my experience with it, again, I think I just was really closed off to it. But it's like my body was so like aggravated and tense already that I would go into PT and it was all internal manipulation. And I'm not even kidding, like I had no idea what it was. The first time I walked in, she was like, "Okay, so this is like what we're gonna do. I'm gonna give you a gown and then I'm gonna come back." And I was like, "Wait, what?" Like I don't know
Mm,
why I didn't like realize that it was gonna be internal. Because obviously, like looking, I'm like, well, yeah, that makes sense. Like pelvic floor, like what else are
mm-hmm.
they gonna do? Like, but I mean, now there are other things that you could do as well, but
Yeah.
I didn't know that at the time. So she was like, "Okay, well, this is our treatment plan. This is what we're doing." So every time I would go, I would have like internal manipulation. And I did that for like 6 months. And I just like, I would have cramping. I had to change my appointments from morning to like afternoon because I would cramp like after. And then I also was not doing like the at-home things that she was asking me to do because I just like felt I really just felt like burnt out. I was like, I
Yeah.
don't want to like do anything like that. Also, like any type of um like physical intimacy that I had outside of that was gone because I was like, I don't want to do anything like that. So I think, and I feel bad like saying that all because it was not anything. I don't think it really had anything to do with the actual PT. I think it was just like the moment in time because now I'm like looking again. I'm like, okay, like I feel ready to like start that journey again. I know more about it. I know like how it could help. Um I have a lot of like rib issues. Like I have ribs that slip out of place all of the time and like my hips hurt all the time. So I'm like, there are other things that I want to target, both like pelvic floor and other things. So I'm like, it's just a different situation now. But I've heard people of going through similar situations, and I'm like, I think we just need to learn more about things before we go into it, and then it would help. So
Yeah, definitely. And you brought up a lot of great points. Like, number one, there is the internal exam. And so, for people who maybe don't know what that is or they've heard about it and they're nervous, this is where we can go in like intravaginally or interrectally to assess what's going on like in the pelvic floor. So, like, this is
yeah.
my pelvic model. And let's say this is like your vaginal opening. We go in with like one finger or two fingers. Um, and then what we can do is actually go in and like assess what is happening at the muscle. So I can say, oh, I'm going to come and palpate like closer back to your tailbone, which is, you can see it's like closer to the back here. Oh, do we, and ask them like, assess for like pain and tenderness, sensation, and things like that, right? And the
Hmm.
goal is that I feel every pelvic floor therapist is to inform people of what it is before actually giving them an assessment, because which is one of the reasons why I am in my own like private practice where I do out of network versus insurance space, because insurance, they usually want them to do an internal assessment to get objective measures like what someone's strength is, it this muscle, this muscle. But me being in like a clinician now, I've been an OT for like almost 5 years and in pelvic floor over three, like I've grown so much and I've learned like just because I test someone's strength in their pelvic floor through like a pelvic floor exam does not indicate like the treatment and what's to be done. Because what's most important is informing people and allowing them to get choice and feeling safe. Because if you just have someone come in and you say, okay, we're going to do a pelvic floor exam and I need you to take your pants off, you're going to have people who are like, what? Okay. And you like, there people automatically think, because the way you say it, like, oh, we have to do this, people feel like, oh, I'm going to have to do it. But that's not
Hmm.
how it should be at all. It should be, hey, I want to bring up something that's a tool we can use to help you with, resolving your pelvic floor symptoms or helping you find a way to better manage your symptoms. We
Yeah.
could do what's called a pelvic floor exam. And then the therapist can use something like a model, like I do, and explain what we do, how we do it, and why, and making sure that there's real intention behind it. I have clients who come in, and as soon as we start talking, I know that this is something that's off the table for a long time or not something appropriate at all. And I have some people who I'm like, this might be a let's consider it down the road. But at the end
Hmm.
of the day, we are able to treat pelvic floor issues without having to do an exam. So for anybody listening, if you've been nervous about going into seeing somebody, know that you have the right to say, no, I don't consent to an exam. And you also have the right to say, okay, I'll try it. But if during the exam you feel uncomfortable or you feel unsafe, or it's something you just don't want to do anymore, you have every right to say, you know what, like we need to stop. Right.
Hmm.
And again, a clinician who really understands pelvic floor therapy and trauma and managing chronic conditions should know that what are some other things we can suggest to the client too? Because some people can't verbally say stop or I want to discontinue. Like I'll have people say, or I'll be like, can you raise your hand for me if you want to stop or be uncomfortable, if you're uncomfortable, right? Just so
Hmm.
that way, if they're not comfortable enough to tell me verbally they want to stop, they have another way to say out. But also, I watch the person, I watch their facial reactions and their body language. And if their body is clearly saying, I'm not happy with this, I'm going to say, you know what? I think for your benefit, we're going to pause and try something different. And I have some clients who are like, oh, just do it. Just like get it done and over with. It's fine. I was like, but why allow that? I can clearly
Yeah.
tell the body does not value and enjoy this, which is where we start to go on like a deeper level of things, right? I'm the kind of clinician that's like, What do you truly care about? What do you value? What brings you joy? Those are the things you have to continue to do. Because if you continue to not follow your instinct, trust your gut, follow your values, right? It's going to make it a
Mhm.
lot harder to feel better because then you're going to be used to saying yes to everything or just kind of believing everything somebody says.
Octavia was founded by someone who knows the challenges of living with endo firsthand. They've created all natural products specifically designed to help manage endometriosis symptoms, and one standout is their Ease Please suppositories. These tiny but mighty vaginal suppositories are packed with 150 milligrams of broad spectrum CBD. They're designed to target pelvic pain right at the source. They help reduce inflammation, relax muscle tension, and improve circulation, all without fragrances, fillers, or harsh chemicals. Octavia's commitment to clean, plant based ingredients means you're getting a product that's both powerful and gentle, and it's crafted with the needs of endo warriors in mind. If you're ready to give them a try, you can head over to heyoctavia.com and use code CHRONICLES for a discount. It's time to give your body the support it deserves.
Which
Yeah.
is where I love having my practice because I get to have these conversations with my clients. I'll give you an example of that. Do you know how many of my clients will be like, well, maybe like sex doesn't hurt, but like I just don't really care for it and I don't want it. But my partner wants to interact with it, so I just do it for them. And I'm like, well, does it feel comfortable in your body when you do it? And they're like, no. I'm like, well, then you have the right to say, I don't want to have sex right now. I don't
Mm-hmm.
want to do this. Because we have so many people, I think, that just we want to make everyone happy. But at the end of the day, like, what are we doing to make us happy, right?
Yeah.
Because that plays such a huge role in managing and resolving your symptoms, right? Pain, um, incontinence, like all sorts of things, right? Once we start to do things that bring value to us and we start to speak up for us, you'll notice the changes in your body for sure. That ties back into your mindset thing, right? You were 20 years old, and I don't blame you for being like, what the hell is this really going to work? Like, I want my symptoms gone. You were
Yeah.
young, you didn't know better, but it's also that's why it's so important that we have conversations about mindset at a younger age. So that way, people who are getting, let's say, diagnosed with endo at a younger age, they know, like,
Mm-hmm.
their journey is going to be different from someone else's.
Mm-hmm.
Mindset plays a huge role. And that's why we continue to have ongoing supports because managing chronic conditions is tiring. And there are some days where you're like, I don't want to talk about my mindset. I just want to be pissed. I want to be frustrated. And you give people that space to be emotional. And then we go back and say, all right, now what can we do to continue to drive the needle forward?
Yeah. Yeah. I 1000% agree because I mean, and it's hard too to like essentially like looking back, I do kind of feel bad for partially the gynecologist that I had that diagnosed me. Um, she actually doesn't work anymore, but she was an interesting case. But sometimes I do look back and I'm like, am I being like too harsh on that situation? Because obviously there are two sides to every story. She was not great at treating me. Like there were some things that were just not great. But at the same time, I do think that like mindset and she definitely suggested a lot of things with like anxiety and well, strongly suggested. And that being said, like I definitely did have anxiety, but I just wasn't those were not the things that I was looking for and I would tell her that and she would just keep pushing it and I'm like, okay, this is not working for me. But at the same time, I can understand how like some of those things had points, like talking about mindset and talking about like getting my anxiety under control and stuff like that and how that would like benefit my treatments. I just don't think I was like ready to hear any of that. I was like, I don't, and that's also part of it. Like people have to be ready to like internalize those things or it doesn't really matter. Now, should you still, as a clinician, bring those things up for sure? Like bring it up until it helps. But yeah, to that
Mm-hmm.
point, I just don't, I think I had to go through, you know, really, I think growing up, but probably my experiences too, just dealing with like I really did go through like a chronic health burnout, and then I came out of it and I was like, okay, so that was terrible. Hit rock bottom with that. Like I have to get better because I'm like,
Hmm.
well, I don't think it could get worse. So I'm like, I have to figure
Yeah.
out how to get better. Um, but anyways, that being said, I did want to ask you what other types of, I mean, like genuinely in my experience with PT, most of our stuff was internal. So what are some things that I guess like what does a typical appointment look like?
So when I have people come into my clinic, I ahead of time have them fill out their intake forms, and we go through all
Hmm.
the consent forms and things like that. And so the intake form asks them, what brings them in. It asks them about their medical history, and then it can ask other questions too, just like, oh, is somebody, if you've been pregnant or you postpartum,
Yeah.
menstrual cycle information, things like that. And then when they come in, we sit and we first talk. We go through the intake forms, but I also ask them, like, hey, like, tell me what brings you in. Even though I can see on the form what it says, I always
Hmm.
say, I know it's on the paper, I know what you told me, but I always like to hear from you what brings you in. And because that actually gets people to talk more and really gives them a chance to tell their story, because you'd be surprised at how many people never got an opportunity to actually express their emotions and like frustrations or concerns, especially when maybe previous providers they've been to, whether it was a previous pelvic floor therapist or
Hmm.
OB or whoever, you only get maybe a couple of seconds to like really describe what's going on, because like, okay, we got to be in and out the door, right? So when I
Yeah.
people come into my clinic or they work with me virtually, we really sit and talk through that, because that's where also a lot of education can happen, right? Where someone might be like, oh yeah, like, and I've been like, I don't experience constipation. And then when we actually talk about it, they say, oh, I guess I actually am constipated, because a lot of people don't realize what that truly means. And
Yeah.
so, based off of someone's concerns and where the conversation takes us, that's where we move into assessments, right? So, I usually will bring up a pelvic floor assessment unless I just feel like at that moment it's just not the right time. But we'll
Yeah.
do assessments. Maybe I'm watching how somebody picks up their baby because that's where they're complaining of pain. Maybe I'm watching somebody try to do some squats because that's where they're reporting symptoms or things like that. And then we can move into other assessments, right? Looking at, you had mentioned like the rib cage, right? Rib cage
Hmm.
plays a huge role in pelvic floor function. Maybe I'm assessing the hips and how mobile they are, how strong they are, and go through that. And sometimes we're even just kind of assessing somebody's like mental health and wellness. Like I will check in and ask them questions like, like, how are you doing and how are you sleeping?
Yeah.
And then based off of those assessments, we start to develop a plan and where we can do hands-on work. So sometimes if we do an internal assessment, we might be doing internal manual therapy, which is when we do things like, maybe kind of gently mobilize, or some people say massage the tissue to help it,
Hmm.
relieve pain or tension. We might be also working on pelvic floor coordination. Like, okay, can you on the inhale, relax your pelvic floor, exhale, lift to contract. We might be also doing stuff outside of the body, right? Because a lot of times pelvic floor is usually the victim of something else happening in the body, right? So we might be working on manual techniques around the rib cage, around the hips.
Hmm.
We might be doing different exercises, right? Exercises to help improve your rib mobility or hip mobility. Talking about bladder and bowel habits, right? If someone is definitely constipated, we talk about how can we resolve that, because that's a huge driver. So then we're looking at your habits, your routines, talking about what are some ways we can implement this stuff in your day to day. For my chronic condition folks, we might do a lot of nervous system
Hmm.
regulation, or really looking into the vagus nerve and how that's functioning in the body, right? I mean, it's always like functioning, but you know what I mean? Like kind of working on ways of helping to get people out of that constant fight or flight mode. So there's a lot of stuff, which is why I have some clients who come in and they think all we're going to do is exercise or all we're going to do is internal work. So when I have some people who come in, they're like, oh, it's actually nice to talk. Or I've had people who are like, I don't really want to talk about it. I just want to like get to work. And it's like, well, we can't get to work until we go through these, or I can assess you more, right?
Yeah.
So when you come in to, for example, see me at Autonomy Public Health, whether it's in person or virtual, we're going to be doing a lot of stuff. And it never has to be anything internal at all. So we can do lots of stuff, as you can
Okay.
see.
Okay, got it. Yeah. I think that that's good for like first of all me to know and like the general public to know that like because I feel like when you say pelvic floor therapy, people automatically, I mean me too, like you go to like internal things and it's nice to know that there are a lot of other things. And even right now like I'm looking for another pelvic floor therapist and I've been like kind of interviewing some. I'm like, let me see how we connect. And I have like brought up just a lot of, I also get this, I have no idea. Like, it's so confusing too, because since I've been diagnosed with endo, it's like everything else, like every other symptom that I have, my doctors are like, oh yeah, like that could be from endo. Like everything gets thrown into that bucket. And I'm like, I get what you're saying, but I also recently got diagnosed with PCOS, which I was like, I'm confused by that because I actually don't have cysts. I just have they diagnosed me based off of like the hormonal imbalances that go along with
Mhm.
it. What else did they? There was something else. They were like they saw like residual cysts or something, but I like don't actively have them.
Yeah.
Anyways, I was kind of confused by that diagnosis. I'm like, wait, you can get diagnosed just based off of the hormonal stuff, and I guess yes. So, but up until then, like everything, all of my symptoms were getting thrown into the endo bucket, and the symptom that I've been trying to find a, a pelvic floor therapist to figure out like if this is something else or if it is endo related is like one, the rib thing, which I do for years. I've had a rib that just like slips out of place and like my ribs have a lot of pain and like underneath them. And then especially when I'm like around my period, which I've always thought was like weird, but that is always like ever since I was 14, I've always had like rib pain around my period. And then the other one is it's kind of like behind, it's kind of near my tailbone, kind of near my hips, but like definitely like my lower back. If I go on a walk, like a long walk or something, not a run, just a walk, the next day, like I can't, it's hard for me to like get out of bed because like my hips are like just, they're like weak. Like I can't support myself. Like I'm limping and I'm like, what is going on? And that's been
Mhm.
happening for the past couple of years. And I was a cheerleader my whole life, like through all through primary school and then a little bit of college. And I was a flyer, so I was super flexible. And for years, I just thought that it was like my body becoming unflexible. I'm like, oh, my body, I just need to like keep stretching because I'm like, it
Mhm.
can't like do what it wants to anymore. But I'm like, I don't know. Like, it could be partially because of that. But then my doctor right now is like, it could also be from endo. Like, I don't, you just inflammation. So I'm trying to find a physical therapist that will, or OT that will help with like that stuff too. But it's hard when you're looking for pelvic floor, but also you want help with stuff outside of pelvic floor. Cause
Uh,
yeah.
which is where it's so important to know that when we're managing like chronic conditions, let's say endo, it's important to have
Hmm.
like a good team because one clinician may not have all the answers, but you're going to have a team of people who can support you. So let's say if you have endo and POTS, right? Working with a pelvic floor therapist, but also working with someone like maybe a neurologist or like let's just say your OBGYN, right? Or a
Hmm.
naturopath. Like you can have more than one person on your team to support you. And a lot of times we need that because
Yeah.
sometimes we don't have all the answers. But then also when we have chronic conditions, you're right, you'll have sometimes the doctor will say, oh, it could be from this, it could be from that. And one thing about endo is that we know more about it, but there's still so much we don't know about it, and
Yeah.
still so much we're learning to say what really is being contributed by endo, because endo is also one of those conditions where we see a lot of people who have another condition associated. For example, the amount of people who have endometriosis and Ehlers-Danlos syndrome, right?
Yeah.
Those go hand in hand. So you have those people who are kind of like, I've got both of these, kind of which one's which. And it's like, well, both the conditions can influence each other.
Yeah.
And, trying to figure out what's causing what, which is why I think the chronic condition burnout is so real and can happen often for people because they're like, okay, I've got this, but then I've got this. And like, what can I do about it? Right. Which
Yeah.
again is why it's so important. We are supportive listeners and we advocate for ourselves, but then also myself as a clinician, I advocate for like my clients and my patients. But as a community, having more open conversations about stuff, because we have a lot of people who I think are like, am I the only one that's going through this? Or
Hmm.
I feel like I'm not getting answers for this. Has anyone else been in this situation? I mean, you'd be amazed at how many people come to pelvic floor therapy on their own because their doctor maybe gaslit them or their doctor just didn't know. Because, right, doctors
Yeah.
don't know everything, providers don't know everything. But as a community, being able to openly say, like, hey, like this is a common thing I see with my prolapse clients is they'll be like, I didn't realize other people were feeling that heaviness or falling out sensation in their like
Yeah.
vagina or their butt. And then when they finally ask like other moms or other people, they're like, oh yeah, I had that. And they said it was a prolapse, right? So,
Yeah.
being able to have conversations and being like kind to others, you would be surprised at how much good you're doing in the world.
Yeah.
So like everything you're saying, Lexi, yeah, so important to find a pelvic floor therapist who's well rounded, but then just having a team of people who can back you.
Hmm.
And also knowing that as you go through different seasons of life, you might need different supports.
Hmm.
People, for example, with endo, they might be good for a while, but then maybe as they go into perimenopause, they need more support, or maybe now they're pregnant, they need more different. We sometimes always need to go back and maybe find two things or take a different approach.
Yeah, for sure. I think that having like a team of people to support you is super important too. Like, and again, when I was younger, like when I first got diagnosed, I would get frustrated that like my gynecologist like didn't have other things for me because I'm like, how do you not like you I mean, in my brain, I'm like, you specialize in this. But in reality, she was not an endo specialist. She was a gynecologist. Like, so she was trying to give me support, but it just was like not what I needed. Like I needed more. Um,
Yeah,
but also that being said, I lived in a really rural area, so there like wasn't more to give, but still, she she did
that's why I
try.
think Yeah, that's why I think with providers, the best thing they can say is, I'm not sure what the solution is for you,
Hmm.
especially maybe if they've exhausted everything they know. Just being able to say, I'm not sure of the answer, but I know there's someone out there who has an answer. And even if they don't know who to give it to, but just again, this is where mindset comes in. Being able to say there is someone out there who has the answer for you. I'm just not sure I'm that person. Because I think as a client, you're going to have more respect for a provider who says that, but you also still have a sense of hope. And you realize like this provider is a person just like me. They don't know all the answers and they're
Yeah.
really frustrated they don't know. But it also shows that the provider cares about you and they want what's in the best interest. Because at the end of the
Hmm.
day, we want what's the best interest. Like I've had clients who've come to me and maybe there was something we couldn't resolve. And I said, you know what? Maybe we need to either go to a different provider, like a different kind of specialist, or see this doctor, or maybe we need to go to a different pelvic floor therapist who really does know more about this, right? Because we just don't know.
Yeah.
And I think it makes people feel better versus like the provider giving you some kind of BS answer or just being like, oh yeah, it's your anxiety, or oh, well, I don't know, I guess you have to live with it. Like that's kind
Uh-huh.
of just not that's not hopeful and it's
Yeah.
belittling and just,
It's not
gaslighting. We
helpful.
don't want that crap and we
Hmm.
don't deserve it.
Yeah. Another just quick question about endo, PCOS, I don't know, maybe like PMDD. How do those things like affect pelvic floor health? I mean, I know that they're different things, but
Yeah. So when we can see that hormones influence like pelvic floor function, right? So when we have
hmm.
people who have, let's say, like endometriosis, for example, we'll see people who have like different types of like chronic pain. That's a common thing. But we also have people who might have issues with like urinary frequency, like they always feel
Hmm.
like they have to pee or they have trouble urinating, right? Or constipation's a huge one, right? I feel like across
Hmm.
endo and PCOS and things like that, because your hormones do play a role in your bowel health. Let's just say maybe you don't have a chronic condition and you're someone that's like, why am I constipated before my period comes? There's usually those like drop in things like estrogen and I forget the other hormone, but that can increase your likelihood for constipation, right? Which
Hmm.
constipation, huge driver for pelvic floor symptoms. If you're not pooping well, you're likely not peeing well. So those are some common things we see with people, but also stuff like sex and intimacy, right? Whether it's painful intercourse or the changes in hormones fluctuations, they don't cause like a lot of lubrication. So things feel kind of dry down there, or
Mm-hmm.
people can't actually find pleasure. They're not like, I'm trying, but they can't actually have things like an orgasm from that. And again, that can affect their libido, can be affected where they're like, I wish I had a desire to have sex or to have an
Mm-hmm.
orgasm, but it's just not there. So we might see that as well. And then even just trying to manage their periods, right? When we are having heavy or irregular periods, right, that's going to affect your mood. It's going to affect your energy levels, which then that affects everything else, right? The
Yeah.
habits you get into, your sleep cycle. So there's a lot of stuff that can be affected, but also too, outside of the pelvis, we might see people who have pain or tension in their hips, their abdominal area, their ribs, their back, which that can affect how they're moving. And then we know the body loves to compensate, right? So if maybe the body's not doing one thing we want it to do, it's going to find another way to do it. And then that can
Mm-hmm.
result in things like pain as well, somewhere
Yeah,
else.
for sure. I know that. I mean, yeah, we talked about this like I guess before we started the episode, but I actually what's kind of crazy, this is just like hormones, but I technically was not supposed to be on my period this week. It started, I think, with endo. Everything is irregular, so I don't really know. But I think I was supposed to start my period next week, but I'm on like day 2 or 3 now. And I'm pretty sure it's because my like heart rate was so high last week for the
Mm-hmm.
entire time. And I legitimately could not get myself out of being in that like fight or flight. Like my heart rate was just insanely high and I was like working and I would be like, okay, I have to sit down because I can feel my heart like racing like crazy. And I was doing like deep breathing to try to like bring it
Yeah.
down. And it just wasn't working. And then all of a sudden this weekend I started my period and I'm like, I'm not supposed to be on this right now. Like I'm pretty sure that was from that,
Yep. Stress
which
makes a huge role, like how,
hmm
our adrenal function, cortisol levels into the body, right? Which I don't want people when they hear this to like hyper focus on cortisol, because there's a lot of people who are
yeah.
going to tell you packages on like decreasing your cortisol levels. Please don't
hmm
go down a rabbit hole with that. But we could talk about how that affects the body and just general stress, right? How that can influence how our hormones, like what they're doing, but then also other things too, like blood sugar levels. So we see that there's all these different systems in the body, which is why, again, that whole team approach is so huge, because the pelvic
hmm
floor therapist may be able to address things like nervous system regulation and stuff like that. But maybe we need someone like the neurologist to work with us on regulating that heart rate and blood pressure that might be going up and
hmm
down, up and down. But yeah, you can see how chronic stress also influences our hormone health, which can also influence our pelvic floor health. I mean, people will say,
Yeah.
well, what causes the pelvic floor dysfunction? Is it the stress and mental health concerns, or is it pelvic floor concerns happen and then stress, mental health concerns arise? And it can be either, right? Sometimes we have
hmm
people who are so chronically stressed, then they start to develop things like pain, an overactive bladder, constipation, or maybe they had those symptoms and now they're
hmm
stressed even more because now they're having to deal with it. So it's kind of like chicken or the egg.
Yeah, for sure. And I like even now I started my period early and then I feel like in the past maybe like year or two, I have like probably 2 years ago, I was going to the doctors and being like, I have a UTI, like something's wrong. Even though I wasn't having like painful urination, it was just like a lot. Like I was peeing so much. And they're like, oh, so you're drinking more water. And I'm like, no, like this literally came out of nowhere. I don't know what's going on. But
Yeah.
it went from like I never would wake up in the night to pee to all of a sudden I would wake up around like 2 or 3 in the morning every single night and I'd have like it would be like I'm gonna pee my pants and I'm like I don't know what's going on. So then I went to the doctor about it and they're like, well, you don't have a UTI. And that was kind of the end of it. And I had brought that up. I've brought that up over the last 2 years with my doctors and now they're just kind of like it's probably endo related. Like you probably have inflammation. They brought up interstitial
Oh yeah,
cystitis.
interstitial cystitis. Yeah, or
Yeah.
we call it like IC for short. If it makes sense
Yeah.
to
I think
people.
they brought that up, which what is that? Can you explain that really quick for people?
Interstitial cystitis is it's one of those terms where like I feel like, again, it's one of those, they can't necessarily directly diagnose someone with it. It's
Yeah.
when maybe other options have been ruled out. But basically, we call it, and other pelvic floor therapists may word it differently, but it's basically when we experience what's called like bladder pain. Um,
Hmm.
and so we might have people who always feel like their bladder hurts or they're always having this increase in urination or things like that, but there's not like some underlying infection causing it. It's
Yeah.
almost like as if the like they were getting there for it to like bladder pain. But when it comes to like IC, a lot of it connects back to that, again, nervous system regulation and the muscle around the bladder, the detrusor, right? That muscle contracts so that way you know you have to pee, right? And it helps
Yeah.
with functioning and being able to let out pee. That muscle can get very irritated, right? Or the muscle's
Mhm.
kind of like spasming, or it's just like, I don't know how to function. So I'm
Yeah.
going to act up, right? So, but it can be confusing because some people, it's like, again, we don't have a test or something we can do to say you officially have IC, right? It's not like where you go and get tested for diabetes. The blood work will say,
Hmm.
yep, you've got diabetes. IC is not like that. It's basically a collection of symptoms where they say, yep, sounds like you might have IC when
Yeah.
things show up in the lab work. But
Yeah.
again, I see that presents differently for people as well. And
Hmm.
again, pelvic floor therapy can address that with already a lot of the other things we would address too.
Are you tired of uncomfortable, wasteful period products that just don't cut it for your heavy flow or for your chronic condition? I get it. Periods can be tough, especially when you're managing endo, PCOS, or another chronic illness. And that's why I'm so excited to partner with Periodile, a game changer in sustainable period care. Periodile offers leak proof underwear designed to keep you comfortable, confident, and leak free. Whether you're lounging around at home during a flare, or maybe you're out tackling your to do list, here's what makes them really amazing. They're ultra absorbent protection for even the heaviest days. There's no harmful chemicals or irritants. They're eco friendly and reusable, saving you money and reducing waste. They're even B Corp certified. And they're thoughtfully made for all cycles and for all bodies. As someone who's been there, I love how Periodile makes me feel supported during my cycle, and trust me, they've got you covered too. You can head over to periodile.com to check out their products, and you can use code Chronic Chronicles for a discount. Yeah, that's pretty much like what happened with it because like I was complaining about it so often and they were like, well, like you don't, nothing's like showing up that's like wrong necessarily, but they're like, obviously, like we believe you that you're peeing a lot, so like it's probably this. And they said that that can happen from endo just with like inflammation going on. But I
Yeah.
have found, especially recently, like I'm on my period right now and I am like peeing a lot. Like it's surprising I haven't had to get up during this interview to go pee because I'm like, this is crazy. And it's like, it's not even like, oh, I can, because I mean, growing up, like I could hold my pee, but now it's like gotten to the point where like, no, I have to go now. Like we were on like a long car ride this weekend, and I'm like, no, we have to go now. Like this
Yeah.
is a, but yeah, definitely. And I've found that I put like an Instagram story out last night and I'm like, anyone else experience this? And like 20 women were like, yeah, I have that. And it's rough. I'm like,
Mm-hmm.
I'm like, I
And
wonder if
guess
it's
what?
endo.
Everyone can definitely get help for that. And like, what's the
Hmm.
driver of it? Everyone's going to have different drivers for like why that's happening to them. But know that you don't have to live with, experiencing frequent urination or having to pee several times a night. If you're getting up several times a night to pee, we call that nocturia.
Mm.
And so typically, unless like you're pregnant or you're elderly, we don't want people getting up more than once a night to pee. But then it's also looking at, even if you get up once a night to pee, is that disruptive to your sleep? Because you have people who are barely awake who get up, they have to pee, and they're a zombie, walk into the bathroom, they pee. And then as soon as they go
Hmm.
to bed, they're out. That's probably not a problem. But for those people where they're like, now I'm awake, now I can't get back to sleep, that is a problem. So,
Yeah.
a pelvic floor therapist can address those concerns with you.
Yeah. Thankfully, I can go back to sleep, but it is, and it's almost like become like a, I don't know, like a habit for me now. Like
Yeah.
part of me, like I wake up and I'm like, I have to pee. And then I almost want to risk it. I almost want to be like, do I actually have to pee? Like, I don't know. But then I'm scared
Yes.
I'm gonna like pee. I'm like, I don't want to pee the bed because I didn't go.
Well,
Like,
that's where we can start to also see that our bladder and our bowels can be trained where we have a more regular schedule. Like your
Mm-hmm.
circadian rhythm plays a role, for example, in your bowel health. If you're very consistent in your day-to-day routines, your bowels are going to be consistent. But then also too with your bladder, it's just like when you're trying to potty train a kid or you're trying to potty train a puppy,
Mm-hmm.
right? You're training it to be able to hold in the urine until it's ready to go to the bathroom. And we can do
Mm-hmm.
the same thing throughout the lifespan of people, right? So if
Yeah.
you're someone that's like, I pee every half hour, we can get you to a point where most of the time you're peeing within every 2 to 4 hours, because that's the typical regular urination schedule, right? It takes time. And that's what we call like bladder retraining. That way you don't
Yeah.
feel like you're always having to worry about where the hell's the toilet. I gotta go
I
to
know.
it, right?
Yeah. Well, and I know for a fact I have unintentionally trained myself to pee right before I go to bed. Like I will, last night, for example, my boyfriend and I laid down at like 8 o'clock. I peed before I laid down, and then I was on like TikTok scrolling until like 9:30. And I put my phone down and I was about to fall asleep and I was like, I have to pee. And I'm like, I know, like I don't think that I actually needed to go, but I do that every night. Like I put my phone down and I'm like, okay, gotta go one more time. And I'm like, I
Yep.
have unintentionally, like that's not real. I don't actually have to pee. But
Well, and a
now I
helpful
do.
tip for everyone listening in is if you can start to avoid what I call those just in case pees, you'll be helpful for your bladder. So that's when a
Yeah.
just in case pee is when you go and pee, quote unquote, just in case, because you're afraid that you might pee yourself later or if there's no bathroom. So, you
Yeah.
know, I mean, if you're going to be in the car for a long time and you don't know where there's a bathroom, like it makes sense. Like, okay, I'm going to pee before we go because it's a long car ride. But if you're
Yeah.
just going down to CVS down the street and then back, you probably don't need to pee before you leave the house where there's no sensation or urge to pee
Yeah.
and be like, oh, because I don't want to deal with it, right? Because it's okay to be able to hold in urine for a little bit. You just don't want to
Hmm.
hold it for hours on end until you're ready to explode. So for those
Yeah.
of you who are like, Audra, like I do just case peas, see if you can start to slowly eliminate that. And I'm sure that's going to help you a lot in the long run. And I
Yeah.
think a lot of us got trained to it because how many of us growing up, our parents were like, you better pee before we leave the house because I'm not stopping this car, and now
Yeah.
we look at it, okay, mom, like, why did you do that to me? Which talking to a lot of my moms, I understand why it happens because they're trying to juggle the life of motherhood, right? Or if
Yeah.
you're like
Yeah.
single dads, they're just trying to make it through the day. And they're like, if we could eliminate a bathroom trip, that might make their life easier.
Hmm.
But at the end of the day, again, if that's a continued thing happening later in life, that's something we might have to address in pelvic floor therapy.
Yeah. I have definitely tried to start um like stopping myself from peeing every time I leave the house. Like literally the other day I was like about to leave to go to Target and I was gonna pee for no reason. And I'm like, if I have to pee at Target, I have to pee at Target. Like it's
Yeah.
not
Yeah.
it's fine. So I stopped myself from doing that. But yeah, the before bed thing is annoying because it's almost like this like even last night I was like, I know that I don't have to go, but I'm not gonna be able to fall asleep until I go. So I'm like, okay, well, that's another thing I'm gonna have to work on at some point.
Yeah. And what's great about pelvic floor therapists is we can teach you strategies on how can we reduce that annoyance, right? What are some
Hmm.
strategies you can implement so that way brain and bladder are like not kind of talking to you right before bed to say, oh, well, you don't really have to pee, but we're going to start to kind of put it in your head that maybe you do. We can work
Yeah.
on some ways because again, brain is super magical. Back to again mindset, the amount of things you're able to accomplish once you put your mind to it makes such a
Hmm.
huge difference.
For sure. Okay. To wrap up, I have like two more questions for you. I know that you probably
Sure.
have patience to get to. But so I know this is kind of a loaded question, but maybe like just like one or two strategies. But for women with chronic pelvic pain, do you have any just like, I don't know, are there any at-home strategies that you can suggest or
Mhm.
something to help with, yeah, the chronic pain?
I think breath work is a really important
Hmm.
tool because we can use breath work as a way to help with getting you into a more calmer state, like tuning into that vagus nerve and helping you get out of fight or flight. But also, breath work can be really helpful for helping to improve mobility in your rib cage, get the diaphragm moving better, but also helping pelvic floor move better because diaphragm and pelvic floor they move together to help regulate pressure in your whole abdominal cavity. So when you
Hmm.
typically inhale, that's when we want pelvic floor muscles to like lengthen and relax. And then when you exhale, they gently lift and contract because your pelvic floor acts like a trampoline to respond to impact, right? So, like those people, let's say, who are leaking pee when they jump on the trampoline, we're trying to train your pelvic floor to act like that trampoline effect. So when you do jump,
Yeah.
it knows what to do. So there's no loss of urine. But I recommend people do what I call like 360 breathing and take a few minutes a day to do that because one, it can really help set the tone for your day, but it also can help you with like decreasing that pain response. But it
Yeah.
also just gives you a moment to like really pause and come into stillness. So what I have people do is I have them, sit, lay down, maybe lay in sideline. And what you want to do is focus on the whole rib cage moving. So like if I'll move my camera down for you because I know we're on the computer. What I have people do is think of the front, the
Hmm.
side, and the back of the ribs on that inhale. They all move out. And then when you exhale, they close back in. Now, when I have people do this, I make sure that when they try it, that they're not like, let me show you this way. They're not going like this and flaring the ribs to get that
Yeah.
open expansion, right? So a lot of people who on that inhale, they can't get the back to move. I might have them hold a pillow and kind of curl forward and focus on back breathing. So if you take your
Ooh.
hands and you place them around your lower ribs like this, you
Hmm.
want to focus on that inhale, ribs open up into the hands,
Hmm. Interesting.
exhale, they close. So when I breathe in,
Hmm.
my front, sides, and back of ribs are all moving out like in a 360 expansion. So you can almost think about this when you exhale, you close. Plus, the breath work allows you to slow down and you can think of let me inhale for like 5 to 6 seconds. Now let me exhale for the same amount of time or even a little longer because the exhale is what actually helps you with slowing down, like helping to slow down your heart rate and things like that. So this is
Oh.
a really great way to help with really any pelvic floor symptom. And this is one of the things I start with people. So that's like one of my biggest tips. Um, Another one of my big tips for people is to really, 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 I know it's going to sound very redundant. There's so many tips I could come up with, but like prioritizing your sleep, when who here has like had a terrible night's sleep, but when you wake up the next morning, you see how moody you are, or you see how you're not maybe
Hmm.
making the most mindful choices. Like maybe you don't eat a full breakfast, you just drink an iced large latte because you're like, I'm not hungry, right? Or
Hmm.
you go through the day and you're super moody, or you're like, I'm too tired, I'm not going to go to the gym, right? Getting good quality sleep is so important for your health because when you wake up and you feel refreshed, you're going to have a much clearer head. It actually does help with reducing that inflammation in the body, which can help with
Hmm.
pain, but it also allows you to be more open minded and make more rational choices. So, breath
Yeah.
work and sleep are so important because trust me, I haven't slept well the past couple of nights. And like today, I'm like really feeling it. So, like, all right, tonight we are going to take our magnesium glycinate and go to bed early.
Yeah. Yeah. Yeah, I think that those are really good tips. I'm definitely gonna try that breathing, like holding my ribs, because that's interesting. Um,
If you find that your ribs feel kind of sticky and they're not moving, then working with someone like a pelvic floor therapist can address that, right? Because a lot
yeah.
of times they'll say, oh, do like diaphragmatic breathing, and they only address belly expansion, but your ribs play a huge role in that diaphragm to be
Yeah.
able to come down to really assist with breathing. And when our diaphragm is moving well, that's going to help with also slowing down our heart rate and things like that.
Hmm. Yeah, I actually this is like weird, and I brought this up to my naturopath, and she was like, I don't know. I mean, she had a couple of things for it, but sometimes when I wake up, if I'm it's so weird, but like if I'm sleeping on my back and I wake up on my back. Normally I sleep on my side, but if I wake up on my back and then I like sit up and I go to take like my first like deep breath of the day, it almost feels like um I don't know if you've ever had pneumonia before, but it
Oh,
like
yep, quite.
That's all that I can like explain it. Like that's what it feels like when I go to take my first deep breath. It's like it's almost like it's like pushing through like something and it hurts. Like it feels weird. And I'm like, oh my gosh. And it's almost like this like if I could show you like it feels like pushing and then it like gets stuck and I have to like push harder. And I'm like, my ribs are gonna or not even my ribs, but I feel like my lungs are gonna like pop. Cause I'm like,
Yeah.
God, like it's
And
weird.
and that's where we can go down even another kind of rabbit hole that's happening too. Like for example, I like looking at people and their ability to like breathe while they're sleeping. Like, does somebody also have something like sleep apnea, right? Because if
Hmm.
you have maybe difficulty actually breathing through your sleep, or you have something like sleep apnea, that can impact how you're waking up in the morning, right? So
Yeah.
trying to make sure you're able to like nasal breathe through the night and that you're able to really open up and kind of gently breathe through the night, because
Hmm.
maybe if you're somebody that has a harder time breathing or whatever, or maybe your sleeping position could impact how you're breathing and stuff and sleeping.
Hmm.
That's another thing too as well, right? Which is something that I've been looking into, because one, like, sleep apnea runs in my family, and it's amazing how like I've noticed how I am habitually more of a mouth breather, and I'm trying to work on breathing to my nose.
Hmm.
This is where I'll have to like see other providers to say, how can I make sure I get good quality of sleep?
Yeah.
Wonder, could that be playing a role? Could that be something? Again, there's a lot of stuff happening, but you're right. Sometimes people, when they do wake up in the morning, if they have limited ability to move that diaphragm when they sleep, right, they might wake up in the morning, they're like, I have to like catch my breath or something, or
Yeah.
they just feel very sticky.
Yeah. It almost feels like crunchy. Like it's
Yeah.
like it's like breathing and it feels like my first like big deep breath. It's like pins and needly, like crunchy, like opening. And I like
Well, they
explained that to my naturopath and she kind of there are a couple things. She's like pretty sure that I have endometrial tissue near my diaphragm because I've had some like other things going on with that for a while.
That's
But
what I was thinking, was
yeah.
maybe for you it's more up there, because some people also have what's called like silent endo, where they don't present with the typical symptoms of like painful heavy periods or pelvic,
Yeah.
because their endo tissue is actually sitting up higher, like towards their diaphragm or their other organs, because endometrial tissue can grow like really anywhere.
Yeah.
It's not always just in the pelvic floor region, it can grow up there. So, and I've had clients who, like, I had one client, for example, she had endo like pretty much all down her left side of her abdomen. It was like
Mm-hmm.
up by her diaphragm, like kind of back towards the lungs, down towards the rectal area, right? So for
Mm-hmm.
her, she was like very, well, we call it like, she just felt so sticky in the left side, even after her surgery.
Yeah.
But yeah, she was wondering like why it felt like it was hard to breathe on the left side, and that was one
Yeah.
why. So for those of you who have endo, you might also have that endo tissue sitting up higher, which could make it harder to breathe. So I bet you that could be something playing a role.
Yeah, yeah, my naturopath is like pretty convinced that they're especially she's great. Like she asked for all my medical records, but obvious like back until I pretty much started my period, which is very nice. I've been like waiting for a doctor to do something like that because I'm like there's just so many things. I've gone to like different doctors for different things, like acid reflux and these pot
Yeah.
symptoms and all of these things and there was a period of time where I had like really, really bad shortness of breath, and I was going to the doctor pretty frequently, and they were doing X-rays. And I had pleurisy for months, and she was like, "I'm pretty sure that this, like your pleurisy, even is from endo," because she was like, "I'm pretty sure that you have tissue near your diaphragm, and then it might have caused some because pleurisy is just inflammation of your lungs." So it's just interesting. There's obviously like there is stuff happening with endo and we're getting more information on it, but there's still just like so much that we don't know that
Yeah.
she's so it could be. And 20-year-old Lexy is like would be like, what the hell do you mean? Like endo could affect my
Yeah.
lungs. But now I'm like, you know what? I believe you. I don't even know. It could. I've been dealing with it for years, so when managing endometriosis, diet always gets brought up. And I want to share something that has been a game changer for my overall health, and that's Muji colostrum. Managing endometriosis often means paying close attention to your diet and your gut health, and that's just where this can make a real difference. Muji isn't just another supplement, it's a comprehensive, all natural colostrum designed to support your body from within. And each serving of this colostrum is packed with bioactive nutrients like immunoglobulins, growth factors, vitamins, minerals, prebiotics, and they're all working together to support your gut health, boost immunity, aid your recovery, and promote overall wellness. If you're looking to support your health and manage endo symptoms through a diet, Muji colostrum is definitely worth considering. Visit getmuji.com, that's getmoogi.com, and use code Chronic Chronicles for a discount. Okay, last question for you. How can people reach you?
So people can reach me. So I have my website, so people can look me up at autonomypelvichealth.com, and I
Mhm.
also have my Instagram, which is at Autonomy Pelvic Health, and I have a Facebook. So if you were to look up Autonomy Pelvic Health, you'll find me there. So people can,
Perfect.
you can reach out to me through those. Which that also includes like my business cell and also
Mhm.
my email. So you're more than welcome to reach out to me by giving me a phone call, an email, text message, whatever. And through my website, you can actually go ahead and book yourself an appointment if you want. So whether it's you want to do like a free 15-minute discovery call to see if we're
Mhm.
the right fit, we can do that. And this is where you can also work with me in person or virtually. I offer both. So that way, if you're looking for a pelvic floor therapist and you're like, or you're like, I just really want to get started. I can't find anyone near me. You're more than welcome to
Yeah.
with me, and I'd be more than happy to help you guys out because, we need to increase the access to pelvic floor care,
Mhm.
especially where some places near you maybe have wait lists like months long, or you're like,
Mhm.
I'm in a rural area. I have no idea where someone is, right?
Yeah.
Or maybe you went to someone and you weren't really happy or found that it was helpful and you want to try again, right? Always welcome to work with me. And I know some people are like, how can you address pelvic floor through the camera? I promise you, we have so many ways of doing it. And it can be just as beneficial as coming in person.
Hmm. Yeah, I for sure people reach out to her. I will put all of that in the show notes as well, so anyone that's maybe reading can just click on links for stuff. I think that's a little bit easier sometimes. And yeah, thank you so much for coming on the podcast. I feel like this was really informational. I hope people learned a lot.
Yes, no, I appreciate being on here, Lexy. Thank you so much. It's such an honor to be here and to be able to talk about this, but it's also great to hear from you, the person who's been through pelvic floor therapy with endo, your experiences, because it helps be able to shape my experiences as a clinician and like, hey, what
Yeah,
can I be doing better? So thank you for sharing your story and your experiences. I really appreciate it.
of course. Thank you.